Have you ever felt exposed and vulnerable during a medical procedure or just an examination? Stay tuned to listen to how HeartSnug is changing patient care, focusing on comfort, privacy, and dignity.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Every innovation has a purpose, and every purpose deserves to be shared. And today we have Lauren and Sarah here with me. Lauren saw firsthand how despairing the healthcare medical process can be when her mother went through a battle with cancer. Always looking to be a part of the solution, Lauren was inspired to search for the ways for patients to feel comfortable doing procedures that are awkward and associated with physical exposure and emotional vulnerability. Her primary goal is co-founding HeartSnug, is to help patients to feel protected and covered, literally. Sarah, her co-founder, has the unique experience of needing an invention like HeartSnug. Since birth, a complex congenital heart defect resulted in her undergoing open heart surgery as a baby. Now, I deal with the adult world of open heart surgery and then understand the genetic disorders. It's a completely new territory. And sometimes we do have to deal with patients in adults figuring those struggles. And especially for Sarah, through her life, she has experienced these challenges inherent with being subject to countless medical exams and procedures, in addition to having a stroke at age 40. A medical disposable bra could have been an invaluable tool for her to utilize throughout her insecure teen years at cardiology appointments, and currently as an adult, desiring an extra layer of privacy as it pertinent to chest exposure. Her primary goal in co-founding HeartSnug is to help patients feel empowered. Thanks, ladies, for joining us and to share that side of story. I think many people, when it comes to innovation in the healthcare space, it's because they had a firsthand experience or family has gone through it. So it ties into that very deep connection in making sure that you're actually creating a solution that truly can shape the better of healthcare. And truly, that just means better for ourselves, better for our patients, better for our caregivers, and overall. And so love it that you guys are joining us as our winners for 2023 Impact Award for Post-Point Pass. And we're kicking off your interview. So excited to have you with us. Thank you for being here.
Thank you so much for having us. We're truly honored to be winners of the Rising Star Award and to be part of your journey as well as ours. So thank you for all the listeners and supporters. We're really, truly grateful.
Yes, thank you.
Yes. So for our listeners who are the healthcare leaders in the space, whether they are part of the organization or their own practice, or truly, we know everyone is a leader if you are making a decision at the end of the day. So how do we stand out to better be more considerate of our patients and of all these big exams where we're in these awkward gowns and going to GYN's office, and especially for heart surgery and for anything that you guys do, it is very exposed. It's a lot of electrodes, lights, things that you just stuck on your body. It's very uncomfortable. So for you guys, where have you seen this solution being able to support women right now who are needing medical help?
Great question. Sarah, she can tell you a little bit about her story and really the impetus of how HeartSnug really came to be within the world of cardiology. And you'll hear her story and her trajectory of her life really being exposed to physical appointments, but really the mental toll that it takes on patients going through medical procedures and appointments, and really the story of how HeartSnug came to be. So Sarah, do you want to talk a little bit about
Yes, absolutely. So I was born with a very complex heart defect. And as you mentioned, I had open heart surgery as a baby. And in particular, as a teen, I remember feeling so vulnerable and insecure with all of the chest exposure, whether it was an echogram, a treadmill stress test, EKGs, you name it. And I remember lying in a cath lab thinking, why can't I wear my bra? Why isn't there, at the time there was just towels and they were constantly manipulated. And I just remember thinking, oh gosh, this is so embarrassing. Fast forward about 5 years ago, I had a stroke and landed me back into the medical landscape. And that's when at that time I had the aha moment that innovation, there had been no innovation in the medical garment space as it pertained to women's privacy rights and needs. So that is really how HeartSnug came to be, which HeartSnug's the first disposable medical chest coverage, which is X-ray safe.
Which is amazing. So how have you guys been able to get your words out there? Are you going to more from individually sharing with patients who are getting procedures, especially women, or you're connecting with physicians to educate them with what's possible?
We're connecting with, we have a multi-pronged approach. I mean, we're connecting with healthcare leaders, with hospitals, with organizations, imaging centers, associations, really. And we actually just launched on Amazon as well. So we've really been trying to educate and bring awareness to the one size fits all gown that was designed by Charles Delorme in 1619 for plague. And, we're sitting here, we're not saying we want to replace the medical gown, but we're saying that we want to look at the holistic approach of a patient going through the medical process. It's not just getting the best procedure or medicine or technology or device. It's really, stepping back and looking at the patient. So we're working with those individuals and leaders that take patient privacy advocacy seriously and really working with them to create trials and bring it through their value analysis and show the value add from a physical and mental standpoint, especially as we're asking patients, female patients, which are 51% of the population, to undergo and perform medical tests and procedures. We wear bras for everything, and we take it off at night for most of us. So why, if we're asking to be, run on a treadmill, that was designed by a man, and for men, their chests are flat, so it doesn't, the electrodes stay where they're supposed to. They can really push their heart at the last second. And HeartSnug, Sarah will tell you that it was being, she was able to wear it on her test and it actually performed 10 seconds longer and made her, because she felt physically supported. So, there are many different reasons that the one size fits all gown is not sufficient at all. And it needs to be changed and looked at. And so we're working with, it seems like everybody has innovation areas and interests these days. And because they know things need to be changed. Like you said, a lot of the female innovators are coming out of firsthand experiences saying enough is enough. We know better. Let's do better because we can. And it's low hanging fruit.
Exactly. And now that you guys have been in the field for a while, you've been educating, you're getting your work out there. So we know every winter has this milestone. Can you tell us some of the major success you guys have been experiencing on your journey?
Absolutely. Well, it was a very, very thrilling time. when HeartSnug was introduced and added in a very large research hospital in California. So we are officially a line item, and patients are wearing HeartSnug there, and we've seen a lot of pictures come through of women inpatient wearing it in the hospital for extended periods of time. We've also it's been really fulfilling to narrow down where we see HeartSnug utilized most and most successfully. So, for example, obviously radiology is a big piece. My mother recently had breast cancer. She wore HeartSnug to all of her radiation appointments, which is 4 to 5 times a week. So you wear it, and then you lay on the table, and the technician uses the radiation. So opens the HeartSnug, uses it on the whatever side breast needs radiating, and then it's closed, and she can go on with her day. She can dispose it. She can continue wearing it because there is some support. So we see it in radiology. Again, we mentioned that it's X-ray safe. So in MRI machines, which is really an exciting area to be involved in. Cardiology, we specifically cut it low. So therefore, the stethoscopes you can access with the stethoscopes, EKGs, and also in a really happy place in maternity and with new moms that are breastfeeding and that whole piece of it.
So yeah, and we've had international interest as well, and we've been reaching out with incredible medical device companies and other partnering with other wearable devices that they're looking at really a holistic approach. And so we've and Sarah, one of this hospital that she was talking about is the hospital that she had her life-saving procedure at. And so we're a line item for the hospital staff to purchase. And that was probably one of the biggest successes that we had because Sarah, we still have the news article from 1977 of her life-saving procedure. Sarah's a miracle. She really is. And so really, I would say for me personally, the biggest success was taking what we designed on a piece of paper from a call to actually going through the legal process, through the CAD process, the production, the whole entire process of the deep dive analysis of the survey and landscape of the medical industry and understanding that there really truly is the unmet need and HeartSnug is the solution. So we are proud that HeartSnug's right here next to us. And, we're small business. We're women certified, diversity certified. So we're proud we're here. We're proud to be able to be on your podcast and your show and to reach the audience and the audience that we have a chance to reach every day. And things come in every day and it's been near impossible to keep up with the leads now. A lot of it at first was going after it and 100% on us doing calls at all hours. I pitched the NHS Innovation East at 3:20 in the morning last week because, it doesn't matter. Whatever it is, the bottom line is we want HeartSnug in front of and on as many women, LGBTQ patients as possible. And our pillar is equity and accessibility. And so in order to reach your listeners and to really gain where we need to in the progression that we're making, we want to reach those rural areas. So anyway, we're really proud with quite a few things and obviously the Rising Star Award as well.
Yes, and it seems like things are finally really gelling together. It's moving because any business, it doesn't matter how early stage or established you are, we're all going to have challenges because the changes in the environment, changes in economic terms, changes in policy that might be beneficial for us or actually make us to have to think everything that we're needing to create and how we delivering those services to at end of the day, we needing making impact. And that impact also means sustainability because if there's not significant return on investment, and then we can't even keep the door open for all the people that are supporting us and all the people who need us to be supported. So that being said, it seems like the good thing is leads are coming in, you're doing all the good work. So what has been something that you feel like, these are the common things that we have experienced, and there are the strategies that we helped ourselves to go be able to overcome that hurdle.
Well, one thing I would say is because so the HeartSnug's patented. It's the first of its kind, the first ever front Velcro closure that exists in the medical garment space. So it's a new segment, right? So there definitely has had to be a lot of education around the need for it. And the common question is, well, we already have the gown. Why do we need this in addition? And our answer is we're not replacing the gown. We want this to be an opt out. So all women have the option to wear it when they go to doctor's appointments if they choose. We believe that it elevates the patient experience. It's our right to feel covered, and it helps communication with doctors and providers when you feel a little bit more in control of your sense of self as well.
Yeah, and you bring up a point when I think in our introduction you talk about the word empowerment, and it definitely, I think it means different things to different people. I know growing up when I was a kid, I never felt empowered in a medical setting at all. I had to do whatever the doctor said. Nowadays with kids, and really our market is from teen to geriatric care. So we're really starting with the teens and working with children's hospitals to help cover them, because nowadays, if my kids go into a doctor and they actually see they're boys, but they see a female doctor. And I tell them every time, if there's any time you feel uncomfortable, if the doctor asks you, please stop and use your words, come out and let's have a talk about it. So I feel like our generation, empowerment, we're trying to gain back that empowerment. We're trying to take control of empowerment versus empowering our youth. So I feel like that's what HeartSnug is really doing in giving patients the opportunity to say, we know unanimously the gown, it fits everyone. Okay, one doesn't work, we'll give you two. But come on. Come on now.
And I think also something to add on to Lauren, what you were saying is, studies, and we've done an enormous amount of trials and research, and the feedback that we've gotten, and it tells us that there are many women that avoid going to doctor's appointments because they're uncomfortable going to specific tests or asking questions, or for cultural reasons, they feel uncomfortable undressing. So there are a myriad of reasons. Yeah, past trauma. So this just helps, funnel that gap a bit.
Exactly. And it's really about understanding the purpose and option. At the end of the day, one of the major drivers in all success is feeling in control, and then feeling that we have a choice to live our lives, to be able to be supported the way that we like to be supported. So that also goes to what would be one or two things that you would love our community to support you guys with?
I start a trial today. I mean, that's really, there's so much we can talk about, but about HeartSnug, and we can explain it, but there is so much that's intangible. Once you put it on, the patient has this feeling of a new level of protection. So we want to get HeartSnug out. We'll send trials out. So definitely reach us at our website at HeartSnug, www.heartsnug.com, or through our Instagram account at HeartSnug. And then also just spread the word. We're all patients, right? So when you go to your appointment, ask if they've got HeartSnug, or tell them to provide HeartSnug. And support us on Amazon as well. So bring it to your appointment, put it in your go bag. Buy it for a new mama to be, who's ever sick of the towels to cover chests and other things. Let's stop that. And so we're empowering your audience to really, all you have to do is send us an email and let's get it going. And you'll see for yourself that, HeartSnug's making a difference in patient outcome.
Awesome. I love you guys for the mission that you're doing and the innovation and the really practicality of what we truly need for females going through any level, even just a routine checkup. So thank you, ladies, for being here. We can't wait to see all the amazing things that you're going to bring to us in the years to come. Until next time.
Thank you, Sabrina. Thank you, everybody.
Thank you so much, Sabrina. It's an honor.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.